Is your therapist harming you by handing you a tissue if you cry in session? I'm Elise, therapist for a million years. Let's talk about it. There is a lot of debate about this issue, which seems so inconsequential, yet people get very, very worked up about it. There's a faction of people who believe that to hand a client a tissue when they're crying is to interrupt their process and is conveying the message that you are uncomfortable with their display of emotion. I happen to think that's ridiculous. I think that's reading way too deeply into something, and I think it is a kind, compassionate thing to do to hand someone a tissue. I actually think there's empathy there. And to just ignore if they have tears coming down or snot running down their face, to me, it just feels wrong. Like, here, it feels like caretaking to me. I don't believe that it conveys the message that you shouldn't be crying. I don't know where that came from. Probably Freud. I don't know. But therapists get really heated about it and are pretty emphatic if they're in that group that is not something you should do. And, for what it's worth, I do leave the tissues within reach. It's not as though they can't reach them, but I don't know. It just feels like the right thing to do, to me. What are your thoughts? If you're a therapist, if you're a client and you're crying and your therapist hands you a tissue, do you feel like she shouldn't have done that, or that she wants you to stop crying? And if you're a therapist and you have made the decision to not hand a tissue, do you think that that's helpful or advantageous to the client? I'm very curious. I don't know if this is some leftover idea, like therapists need to wear cardigans. I'm wearing a cardigan. Totally coincidental. I don't know. This doesn't sit well with me. Let me know what you think, and sign up for my newsletter. The link's in the bio.